Hello, I'm Dr. David Persse. I'm the Chief Medical Officer for the City of Houston. We'll be discussing our wastewater data surveillance for COVID. We've used this as an early warning indicator of what was going to happen throughout the pandemic, and we'll be sharing our thoughts about how we used it individually, what we see as its future potentially, and other aspects of the wastewater phenomenon, which started largely here in Houston. So my colleagues today with me are the Director of the Houston Health Department, Stephen Williams, who has been my brother in arms in city government throughout this as we try to lead the city through the pandemic in using wastewater. And along with him, we have Dr. Jamie McCarthy, who is the Executive Vice President and Chief Physician Executive for Memorial Hermann Hospital System, which is a 17 hospital system in the greater Houston area, with its flagship facility being in the Texas Medical Center. And also with us, we have Dr. Ed Septimus, who is a senior lecturer in the Department of Population Medicine at Harvard Medical School and an adjunct professor at Texas A&M College of Medicine. He's an infectious disease physician and on the COVID-19 task force at the Memorial Hermann system here in Houston. And gentlemen, I want to thank each of you for being with us here today. And as I said, we'll be discussing our experiences with the wastewater report. But let me preface this by saying that the report throughout most of the pandemic has generally come out on like Friday evening. And in the beginning, because we were inventing this sort of as we were going. In the beginning, the report would come out on Friday evening, and I came to learn the team might do some tweaking over the weekend. So I started reporting it out pretty much first thing on Monday morning of what the values were, giving the team time to tweak things. I reported first to the mayor, and along with the percentage is the positivity rate. And one thing that I think that the viewers need to understand is that when we talk about a percentage, and that's what you'll see reported in the public, that is in relation to the July 6, 2020 value, because that was the peak of the first wave. And the reason it's important for you to understand that's our reference value is if you actually look at the unit of measure that the lab uses, it comes to something like 1.3 times 10 to the 7th virons per cubic milliliter, which means nothing to any of us. So we chose that date of July 6 because that was the peak of the first wave as an arbitrary 100%. And so it can either be higher than that or it can be lower than that. But the other thing we learned was that it isn't really the number, it's which direction the number is moving and how much of a change there is from one week to the next. So again, like I said, we generally got the numbers on Friday afternoon, let the team do some tweaking over the weekend, and report them out on Monday morning. And these are now publicly reported as well. We don't just keep it to ourselves, they're publicly reported. Our team, the wastewater team, which is a combination of the Houston Health Department, the Rice University, and in the beginning, Baylor College of Medicine was actively involved in it. And so we now report that on a public page. But let me turn to my colleagues and ask them, Dr. Williams, you're the director of the department. You've been in public health throughout your career, which goes long before you came here to Houston, which has got to be pushing 20 years ago now, right?
Yeah, since 1985, actually started in Phoenix.
Yeah. So what was your experience as we went down the road with wastewater, and how did you use it?
Well, first, when I first had the conversation with Dr. Hopkins about the possibility of us really enhancing our surveillance through wastewater, I was really initially intrigued. Hadn't really thought about it a lot, but then began to imagine how useful the information was. The fact that we could really have a radar that was telling us what was going on throughout the city of Houston, because our wastewater system is such that it covers all of Houston. And so it became really intrigued. As time went on and we started to see the value of it, certainly knowing that it was really a predictor of what was going to happen probably within 2 weeks, began to imagine how useful it would be in using it, to predict other conditions other than COVID.
So we're in fact, you mentioned, but there are other illnesses in the community that the public is, for example, polio made a big splash recently up in the New York area. And so people are wondering, well, is that going to happen here? And are there ways to look for that, influenza, et cetera. So moving forward, we're going to be incorporating some of those as well.
Yeah, I think it's interesting, and certainly we're all involved in it, but just determining exactly what conditions that we would routinely test for. I think, given that we'll have a panel of experts locally here advising us on what conditions and figuring out really from an administrative standpoint how to fund it. I think it's an excellent surveillance tool, really cutting edge.
One of the things about it is that it as you mentioned, it's in all neighborhoods. And so one of the other things throughout the pandemic is that we were relying a lot on testing. Well, as the pandemic waxed and waned, the number of people going to get tested waxed and waned as well, bringing us to some concern about the accuracy of those numbers. But the wastewater is consistent and it's global across the community.
Yeah, I think certainly when the testing numbers started to go down, we realized that, that wastewater was of greater value than the positivity rate that we were usually tracking with that. Initially, it was good to benchmark what we were seeing at wastewater with positivity rates because the amount of testing that was going on was such that, we could rely on it to a certain extent. So once, the numbers waned, wastewater became a more accurate predictor of what was going on within our community.
So let's take that. So Dr. McCarthy, in your role, and you and I are colleagues going way back because we're both emergency physicians, and now you are in the executive wing of a major hospital system in the area where you've got, it's a healthcare provider, but it's also a business, and you've got to run that business. You've got to be efficient with it. And so when it came to the wastewater, my experience with you is that you pretty quickly came to appreciate the value of it. So tell us a little bit about from a clinician standpoint, as an emergency physician and still being actively involved in the emergency department, but also from an administrative hospital administration standpoint, what the wastewater numbers meant to you?
So yeah, it's a great question. It actually became the best predictor we had for future staffing needs in terms of COVID units, and as well as predicting staff vacancies. So, right, it's not just as you say, we have a business to run as well, but it's not just the patients we're taking care of. We need to be sure we have people to take care of those patients, and understanding what staffing pressure was going to look like, and understanding what our unit capacity and COVID unit capacity was going to need. So we really, I think we didn't know what to do with it when it first came out, because it was just the number. Like, well, all right, I've got a number and I got patients in the hospital. And I don't know what to do with it, but it looks like it's getting worse. But as we came through the Delta wave, we went back and mapped through our previous waves what the positivity rate locally had been, number of the percent to your index case, and how that translated to hospital admissions and what our units were. And what we found is they tracked very, very closely. So looking back at the previous wave of the winter through our Delta, we could say, yeah, when we're at 500%, we've got this many inpatients. So as we were looking, and then your wastewater data would come out, so we mentioned about 2 weeks. We got about 2 more weeks of increasing volume, and we know the trajectory because we've seen it. We're mapping the trajectory. We know how many more beds we're likely to need over the next 2 weeks. We know that we're going to need more staff. But where it provided that tremendous relief, both in the Delta wave and then the Omicron wave, is when we were cresting and we saw those numbers flatten. The whole staff, anyone who was planning for the next group of what we were going to need, took a collective sigh of relief, like we crossed the hump, right? We know that things are getting better. And what we found now, we're still mapping this, was we're seeing now as cases are climbing, we know they're not translating to the same rate of hospitalizations, but we're still tracking our daily hospitalizations, and we're still tracking our daily absenteeism for COVID diagnosis, knowing that as that number keeps going up, the trajectory is lower with this wave, fortunately, but we're still using it for predictive modeling on what we're going to need for staffing over the next 2 to 4 weeks. And I'll tell you the other part of this, that in this last Omicron wave in January, when we had crested, a colleague of mine who's in a similar role at a large health system in the upper Midwest called me very stressed out because they were going through developing crisis standards of care, how they were going to actually start withholding care if things got worse. And I said, what's your wastewater data? And he goes, I don't know. He said, we're not looking at it. He said, well, someone's probably looking at it. So his university wasn't, but they called the city and they were. And he said, well, he sent me the data they were looking at. He said, I don't know what to make of this. And he had every day. So you don't do every day, just do 2-week intervals. And he went back and he said, it's going down. It's just, you're going to be fine, right? And he called me. He actually sent me a present. He was so pleased. He's like, his whole staff are so relieved. They're like, we were preparing to do the unthinkable. And now we realize we don't need to be prepared for that. The wave is over, we're resting. So we found it an essential planning tool for us moving through this pandemic. And I wait for your text every Sunday evening and Monday morning to know what it's going to look like.
Yeah, and I should point out right now our numbers are going up, the percentage is going up. And the other, I think you made another important point there that I want our viewers to understand is that with each variant, the relationship between the wastewater percentage and positivity and hospitalizations changes just a little bit, it seems, right? So right now, with this current wave, which is growing, and Dr. Septimus, you're going to give us in a moment here a little bit about what it is that's making the numbers go up right now. We're finding, and you mentioned it, is that the number of hospitalizations are not going up quite as steeply as we had seen with previous waves. But even if you look at the Alpha, the Delta, the Omicron, there were subtle differences in the time window between when the wastewater percentage would go up and when positivity would go up, and then when hospitalizations, and also sometimes going up more steeply than others. And so with each variant, there comes a little bit of a different nuance to it. So you got to pay attention, you got to stay on top of it. But it is very reliable, in my opinion, and it sounds like in yours as well, that it is a very reliable, probably the most reliable predictor of what's going to happen in 2 to 4 weeks at a time.
Yeah, so just a couple concrete points on that. So the indexing off July, the wastewater, the percentage of admissions in Delta the Delta was about the same. But when we then go to the Omicron, we had, with the wastewater data being significantly higher than we saw during Delta, we didn't see that same level of admissions. They dropped. We saw fewer ICU admissions and fewer overall hospitalization admissions. Right now, what we're looking at compared to the last Omicron wave for the same percentage is about 60% of the admissions we saw during the Omicron wave. But it's certainly out there. And I wouldn't overstate or understate, I guess I'm thinking the impact on staffing. Right? That's another really important part for us, looking at what our staffing needs and absenteeism is going to be related to COVID diagnosis. So both of them super important. And the rates are different, but they track and they're directional.
Right. Dr. Septimus, so you're our infectious disease expert, and you've been, probably the one of the most well-respected infectious disease doctors, certainly in Houston and as well across the nation. And you have been on top of this from day one. We've been emailing back and forth, and we've been on a variety of virtual meetings weekly for months, well, for years now, quite honestly. First of all, let me just get your reaction to what your thoughts are on wastewater as a monitoring device for a community of this size. And then I've got like 19 other questions I want to ask you, but I'll not beat up on you too badly, I promise.
That's right. No, I think Dr. McCarthy said it extremely well. In addition to my role as infectious disease, as both of us, we actually advise other organizations outside of healthcare. One of the biggest challenges that I've had, and I'm sure all of you will share this, and that's developing trust with our community and the organizations we serve, and providing them with accurate, unbiased information that they can rely on. Wastewater certainly fit into that beautifully. But I take that report that we get every Monday morning that you nicely text me, and I'm able to tell the organizations that I advise outside of healthcare and give them an idea of what they can expect. And so wastewater provided for me, and I think we've all sort of said this, for the first time during the pandemic, we could be proactive and not reactive. And that was extremely valuable, I know, in the planning at Memorial Hermann and other organizations, and also the other organizations that we serve outside of healthcare. So I think that's extremely important. And to be honest with you, I didn't know much about wastewater, but as you know, I put out a newsletter to healthcare professionals, which I started in 2020. I've now become addicted to my newsletter.
So are we.
And I was reading a report from the CDC that was published in Morbidity and Mortality Weekly in 2020. And they mentioned that the highlight of the article was wastewater surveillance. To be honest with you, I hadn't thought much about it. And there in that article, they talked about several areas in the country, one of them being Houston. Far and away, the most sophisticated and the most encompassing wastewater was in Houston. And it was at that point that I realized we had a tool that was probably even better than the current measures that we were using. And so that got integrated into the newsletter, and it got integrated into the communication to the groups that I advise, and it's become very, very valuable.
Couple of questions. Put on your infectious disease physician hat for a moment, and I want to go back to the nuances of interpreting the data. So a couple of things occurred. I can't remember which wave it was, but you sort of pointed out that with one of the waves, the percentage of virus found in the wastewater went up at a much greater rate than what we saw in terms of positivity rate and hospitalizations. And there was some thought that, well, maybe with this variant, people are excreting more virus, and that's why it's going up more. So there's, there are nuances with the virus that can impact the percentage. There's nuances with the virus that can impact how ill people are. There's nuances with our inherent or vaccine-induced immunity in the community. And so talk to us a little bit about those cofactors that can influence the interpretation of the data.
Well, I think it's a combination. We're in a very different phase of the pandemic than we were a year ago. Estimates are that we probably have an 80 to 90% community immunity, either through vaccination and or natural disease. And I think that's one of the reasons we've seen this uncoupling between the number of cases in the community and the number of people who get in our hospital. The other challenge is, and Dr. McCarthy may want to comment on this, is that since we do screen a lot of our patients who come into the hospital, many of them are screening positive, but they're not being admitted for COVID, they're being admitted with COVID. And so we've had to separate that out, and depending upon the risk group, maybe it'll be a 50-50 split as to how many people actually are admitted with COVID versus just incidentally testing positive for COVID. And that's, again, an indicator of potentially the severity of the outbreaks that we're seeing in our community. And each of these viruses that have evolved, and what's going on now, we went from BA5 very quickly to the BQ variants, and almost at lightning speed, we're now dealing with the XBB variant. All of these are variants of the original Omicron strain, but each of them have their unique characteristic, and the reason they become prevalent is they outcompete the previous variants. One of them, of course, would be they're very immune evasive, and the normal neutralizing antibodies, they escape the normal neutralizing antibodies, and that's why people get generally mild illnesses if they have immunity. The other factor is some of our monoclonals, some of the therapeutics that we use are unfortunately no longer effective against these new, which is for us, taking care of these patients is a real challenge, trying to stay ahead of it, but our antivirals, such as Paxlovid, have still remained active. So we have many, many more tools to keep people out of the hospital. Vaccinations with the new booster has not been very good. As you know, it's really lagging behind. But many people who have either had natural immunity or been vaccinated still have what we call their T-cell responses, okay, which keeps them from getting severely ill. So what we're seeing now in the hospital, we're seeing an older population being admitted, the ones who have multiple underlying diseases, or the ones that are unvaccinated. But as Dr. McCarthy said, there is a little bit of an uncoupling. We're not seeing the same proportion admissions compared to the increase in what we see with wastewater surveillance or the percent positivity, which is a hard number to get our arms around because many people are testing at home, so the rate's probably much higher. But there is an uncoupling, hopefully, although the trends are all up. Hopefully we're not going to see the kind of surges that we saw with Delta or the original Omicron.
Thank you, Dr. Septimus. Something you said triggered something in my mind. I want to ask Director Williams about. So you talked about how things have changed and from variant to variant, and so part of this goes to, you are the leader of the health department, which speaks to the entire community. So a couple of things. One is we talk about the local Houston community, and so what do we do? What do you do to maintain attention of our local Houstonians? And then secondarily, what about your colleagues across the nation? And to Dr. McCarthy's point about his colleague in the Midwest who was not using the wastewater. So a little bit of public messaging and using it both locally and nationally.
Well, just to put what we did with wastewater in context, we really use that as our driver for our access and equity strategy. We knew where there were, high incidences of the virus, and yet there are either low testing or low vaccination rates. And so therefore, we, through contractors and through staff that we hired, did significant amounts of outreach and education in those areas, reaching out to faith-based organizations. We went to, store owners in various communities, really spreading the message about first testing and then getting vaccinated. We use various media outlets, ethnic newspapers, radios, or whatever, and we also use certain celebrities to really get the message through the groups that were negatively impacted. And the thing that really I look at is when an average person come up to me and tell me what's going on with wastewater. Then I know that, that's effective, and that's happened frequently. They say, well, the wastewater is going up, isn't it, Stephen? Like, yes, it is. And so for me, that's a sign that, it is being effective. On a national level, I participate in a coalition of health directors of the largest urban areas within the country. And our staff, Dr. Hopkins, has been on several sessions really talking about what we're doing here in Houston relative to wastewater. And I think they really understood that from a surveillance standpoint, that, it was really effective. It's something that we needed to look at, because core to what we're in public health we're trying to do is to ensure equal access to vaccinations, to testing, and certainly to healthcare overall. But wastewater is a terrific tool to guide us to specific populations within our broad Houston jurisdiction, to where we need to, really focus our activity.
Yeah, I think that's one of the things that probably the general public doesn't realize, is that while we report a percentage for across the entire city, we actually, through the team, have the ability to look at areas sometimes as small as zip codes, and also individual buildings. It all has to do with the plumbing, quite honestly. So as the wastewater, the sanitary sewage system is built in communities, and here in Houston, we've got one challenge, is that about 50% of the city is on one wastewater treatment plant, and then the rest of the city is on a variety of smaller ones. It all has to do with the history of the city and how things grew and the funding that was available. Excuse me, but we also have been using it to look at certain homeless shelters and schools and jails and prisons and other places where we had particular concerns, so that, on one hand, we talked about across the fourth largest city in the nation with a population of between 2 and 2.5 million people, but we can also narrow it down to a single building if we need to. And I don't know that everyone understands that, but that is a feature of a elaborate wastewater treatment system. So.
Yes, I think it gave us a lot of credibility, for instance, with the sheriff's office, since, they have a large jail system here in Houston and Harris County, and certainly with the schools. We did additional work with the schools. We had a liaison and some consultants actually follow up with the nurses to see exactly what they did with the wastewater information that our folks shared with them. Hopefully in the future, we'll be able to follow up with that and to develop, I think, more effective strategies in dealing with anything that happens within schools. The congregate sites, like the homeless shelters or whatever, I think it was a tremendous help with our disease investigators that really followed up and worked with those shelters. And we were able, I think, especially with nursing homes, we were able to be particularly proactive and effective, knowing that we had this as a tool.
Similarly, Dr. McCarthy, your colleagues across the nation at hospitals, do you have any sense as to how close attention? Now, you gave the one example of your colleague in the Midwest, but since then, do you have any sense as to how hospitals across the nation are using their local wastewater data?
So I think a lot of it depends on the quality of the data they're getting, right? So as Dr. Septimus pointed out, right, we've got a very robust system through the city that has produced high quality data and I think importantly, in a very digestible format. When we were first looking at the wastewater data, remember, we talked about it. You said, just like, this is really granular and hard to make sense of, and it was. So I know colleagues in other cities are using it, but I think the partnership with the city being able to produce a high quality digestible data is really the most important part. And the graphics that you have on your website are fantastic. So we can look at it. You've got a heat map where you can see it going up, going down. I can easily pull that down and overlay that on our hospitalization data, and the graphs just line up, right? It makes it very easy to quickly interpret and know what we're doing. So I think there's real opportunity to educate many other areas and large health systems about, and perhaps cities about the data you provide. If you can provide it in this kind of format, makes it actionable for healthcare institutions.
I'm going to bring this back around to one of the things that Director Williams mentioned in the beginning about other pathogens. And so, Dr. Septimus, you are the head of one of our COVID-19 many committees, but one of the challenges that we have as we move forward with wastewater, we have the potential to test for many, many pathogens. So which ones do we test for, and how are we going to figure that out?
Well, as Dr. Persse knows, we just formed an advisory group to advise the city on just that issue. And what we're trying to do is marry up those organisms or diseases that we think have a high priority versus those conditions that we can actually do something about and make it actionable. So we're looking at a whole variety of illness. For instance, especially in my area, I'm very concerned about the increasing numbers of multi-drug resistant bacteria that are circulating in all our hospitals. And can we actually pick that up by looking at hospital surveillance? Can we look at what's going on in the community? And is it actionable? We could look at certain viruses. Of course, we do influenza and RSV around schools. What's going on in congregate living is extremely important. So we're looking at a variety of targets, and we're trying to match up those targets that are important from a public health perspective with those that we think we can do something about. And I can't emphasize enough the role of public health in maintaining the health in our community. And please, let's learn the lessons of COVID-19. I go back to the pandemic of 2009, which a lot of the problems that we experienced with COVID were apparent. The director will remember this. But it was a very wimpy virus. And we just sort of forgot it and we moved on. We can't forget the lessons that we've learned here. And one of the things we've learned is that in collaboration with public health, academics, and the community, we can do fantastic things here in the city of Houston. And one of the backbones of that surveillance moving forward can be what we decide to do with wastewater management. And so that's my hope in co-chairing this advisory group, is to make our wastewater surveillance, now it's the best. But I want to make sure it remains at the leading edge of what we can do in public health in Houston and be the example for what other areas of the country can do as well. And I think we can do it.
So it sounds to me, and let me see if ask each one of you very briefly, that wastewater surveillance is here to stay. Would you agree?
I'll agree with that.
Absolutely.
Yeah. And so one thing we do as we wrap it up here is I want to thank the many institutions locally that have participated with us. So, in the beginning we had Baylor College of Medicine, Rice University, and the City of Houston's Health Department. We now actively engage with all the academic centers here in Houston, with the public, with many of the special groups that Dr. Septimus mentioned. And this is all because of funding. And I thank the CDC. The City of Houston has been awarded a Center of Excellence grant, which will help us bring this along. I think we can all see the power of this, the importance of this, and the need for this to be part of our future as we look to
And I think
take care
we
of
can't
communities.
forget our public works partners.
Oh,
Because-
absolutely, yeah.
Because we don't go down and do that testing ourselves. We really have to partner with the people that are actually running the system itself. And so our public works department has been an excellent partner with us in this.
Yeah, thank you for reminding me of that. And you're right, because again, most of the folks don't know, but they develop these contraptions that go down into the manhole and are sampling 24 hours a day for a week at a time. And somebody goes down there and retrieves those. And so that is a lot of hard work, and that is potentially dangerous work. And so So it's not just the health department, and our academic partners, it is the folks at Public Works. So again, thank you to everyone for watching, and we'll talk to you again soon.